Okay, welcome to the stress unit, AQA. So we're going to look at stress, some of the physiological responses to stress, and how stress is researched and some of the models that are applied to explaining stress in the body and mind. So the first one we look at is called the GAS model, General Adaptation Syndrome. So this is the body's response to stress. So the first thing to point out is that there's three stages: the alarm stage, the resistance stage, and the exhaustion stage. So this is Selle's General Adaptation Syndrome. So the first stage is the alarm stage. So this is the initial shock phase when a stress is first encountered. So you're crossing the road and a big saber-toothed tiger comes running at you. The fight or flight mechanism is going to be activated, and you'll get the physiological changes that occur through adrenaline and activation of the sympathetic branch of the autonomic nervous system and the parasympathetic branch of the autonomic nervous system. So classically adrenaline and noradrenaline are related to that part. The second part is the resistance stage. This is the body's attempt to cope with the stressor, and you get the physiological arousal that remains quite high, and resources are mobilized to try and maintain this heightened state of being ready to fight, flight, or freeze. The third stage is the exhaustion stage. So this is when the body has become depleted due to prolonged exposure to stress. The immune system will weaken, and this puts people at risk of catching viruses and illnesses, pathogens, etc. Can be life-threatening in certain situations. So this GAS model, General Adaptation Syndrome, basically helps us to understand how an organism responds to stress, and how short-term stress and chronic stress impact a person's health. Okay, moving on to the SAM pathway. So this is the sympathomedullar adrenomedullary pathway, or on the screen it says sympathomedullary pathway. But SAM is a good way to remember it. It's the sympathetic branch, and it's the adrenal medulla that gets activated. So this is a short-term stress, quick fire response. So the autonomic nervous system is activated due to the hypothalamus perceiving a threat. That then initiates the sympathetic branch of the autonomic nervous system. That then activates the adrenal medulla, which is the adrenal gland above your kidneys, to start releasing adrenaline and noradrenaline into the blood, and this creates the fight-flight response, fight, flight, or freeze. So this is a mechanism that we've evolved with to help us survive. So it's automatic, we don't really think about this. So some of the physiological changes to this is your heart rate goes up, pupils dilate, blood pressure goes up, breathing becomes rapid, and you get muscle tension, and glucose is released for energy. Blood flow is diverted away from your stomach to the main organs and the muscles that would help you survive. This is the initial short-term fight, flight, or freeze response. If the stress is longer, chronic stress, that's a different system called the HPA system, which is the hypothalamic pituitary adrenal system, which is linked to long-term stress, or the HPA for short. So the HPA system is a bit different. So the hypothalamus is activated, and that releases CRH, corticotrophic releasing hormone. And the second part of this is the pituitary response. So the anterior pituitary gland, at the front of the gland, posterior is the back. So the anterior pituitary gland responds to corticotrophic releasing hormone by secreting adrenocorticotropic hormone, or ACTH, into the bloodstream. The adrenal cortex is activated, so this is the outside part of the gland, whereas the adrenal medulla is the inside part of the gland. And this releases cortisol, which is a stress hormone. High cortisol levels signal the hypothalamus and pituitary to reduce hormone production, creating a regulatory feedback loop. So the HPA system, hypothalamic pituitary adrenal system, is our response to chronic stress over a long period of time. So cortisol is well known to be a stress hormone, and that helps to maintain blood glucose levels and suppresses non-essential functions, and also modulates immune responses. So chronic stress can be a lot more devastating for your health, and if you're persistently stressed over a long time, it can include issues with depression, anxiety, cardiovascular disease, and a weakened immune system. So understanding this is beneficial for your own health as well. So immunosuppression, or global immunosuppression, so this is some of the health consequences of chronic stress. So chronic stress weakens the immune system, suppresses lymphocyte production, reduces antibodies, and impairs the ability to fight infections and diseases, which put you more at risk of things like cancer, slower healing if you've got a wound, etc. And you can also have cardiovascular issues, heart rate going up, blood pressure high, stress hormones high, can result in hypertension, increased risk of heart attacks, etc. So chronic stress has quite negative effects on your health long term. So research has shown that chronic stress acts as a significant risk factor for both immune dysfunction and cardiovascular disease, which is why personally I always champion exercise, because it helps to act as a buffer towards a lot of these things. So that's the chronic stress over a long period of time can have quite negative consequences. So some of the sources of stress, if you look at major life changes, so this is based on Holmes and Rahi, or Ray as some people say, social readjustment rating scale, which basically is a scale of events from 0 to 100, with 100 being the worst. So I think death of a spouse is at the top. That might say be worth 100, and each of these events is allocated a number of how sort of stressful it is. And if you score kind of over 300, you're at a high risk of suffering illness. Now, some of these might be seen as positive, so some might be a bit subjective. I mean, if you hate your job and you can't wait to get out of there and you lose your job, that could be seen as a good thing. But I suppose for a lot of people, it can be stressful if you lose your job, because that can then lead to financial problems. So a lot of these also interlink as well, or have a knock-on effect. Now, some of these you've only experienced once in a lifetime, so we also look at what's called daily hassles, which is by Lazarus and Folkman. So a lot of these are like day-to-day things, like, stuck in traffic, problems with chores, conflicts at work, time pressure for deadlines. So all these are kind of daily things, which can add up to be quite stressful for people. Minor stresses, you get things like road rage. People are stressed out and then they get out and stuck in traffic or something, and they start getting really stressed. So these can have an impact on your health as well. Workplace stress can be quite severe. If you're working in an environment and you've got time pressures and deadlines by your boss, you get stressed out and anxious. I must say that stress, the definition of stress is the perceived ability to cope with demands placed on you. So if you think about it as like a piece of wood, you keep loading up the wood in the middle, eventually it's going to snap. So you need to be able to reset so you can load and unload, and keep a healthy balance. In some jobs, people are unclear about what their responsibilities are or what their role is, and that can create a lot of psychological stress. If you're not sure what's expected of you, or somebody is slightly higher than you or something, and it's causing some problems with your supervisor or your boss, you get things like bullying at work, discrimination at work, poor communication. A lot of people find that very stressful. And also a lack of control. If you've got limited autonomy and you can't make your own decisions, a lot of people find that stressful as well. It's almost like you're powerless in a work environment where a lot of people do like to have a bit of autonomy. So workplace stress is a significant public health concern. Really severe economic complications and implications through people being off work. Healthcare costs, productivity goes down. You've got to then pay someone else to come in as a temp, claiming sick pay, etc. Not contributing to the economy, so it can have a big impact on the finance of the country. I think if say, for example, 52% of the population aren't working due to mental health or disabilities, it can have a big impact on the economy. Here's some ways you can measure stress. So you've got self-report scales. People complete these themselves, but they can be subjective. For example, Holmes and Rahe's life event scale. Also, some stressful events can be positive. That's called eustress. So, for example, some people, depending on the personality, might find time pressures and stress from the boss really motivating, like it's a challenge. But for a lot of people, maybe they don't. The easy thing about questionnaires is that you don't need to be trained to give them out, and they're kind of easy to administer. And unlike an interview, you can give lots out. Whereas interviews, you just typically have one person at a time. The downside is you get social desirability bias, so people might not be that honest about what they're talking about, and might not be that accurate in their memory. Physiological measures for stress. You've got biological indicators. You can measure blood test, cortisol levels, blood pressure, heart rate you can measure, immune system. Good thing about that is it's kind of objective and quantifiable, and it isn't subject to any bias really, or reporting bias. The downside is you need the equipment and obviously the trained professionals to do it. Now, people can respond differently to stress, depends on your personality type. So you could be a type A, which are competitive, the kind of time urgent people, hostile, impatient, but they are linked with cardiovascular disease risks and higher stress levels. Type B personality are more relaxed and patient, creative, generally have lower stress levels, and obviously better cardiovascular health outcomes. And type C are more cooperative, patient, suppress negative emotions, but may also be linked with increased cancer risk due to chronic emotional suppression. Again, exercise can act as a buffer to a lot of stress and help you to manage stress easier. On the other hand, you could be a hardiness type personality. So look at 3 C's: commitment, control, and challenge. That represents this sort of personality, and they seem to be more resilient to stress. They almost thrive under pressure. They want the stressful situations. They interpret it as a challenge rather than a threat. And if you interpret something as a threat, you're going to activate your fight-flight mechanism, and over long term that can be switching to the HPA system, hypothalamic pituitary adrenal system, that results in chronic stress with cortisol, stress hormone. So in terms of stress management, some of the things they look at: drug therapy, stress inoculation, and biofeedback. I think they should also include exercise in here, but for some reason they don't really mention exercise. We obviously got drug therapy, benzodiazepines to help with anxiety, SSRIs or selective serotonin reuptake inhibitors to manage mood and stress, anxiety disorders. And then you've got beta blockers that work on the cardiovascular system to help reduce your heart rate. CBT or stress inoculation therapy is a cognitive behavioral approach developed by Meichenbaum. So you learn to have gradual exposure and build your stress coping skills. You've got 3 phases to this stress inoculation therapy. You've got the initial phase of education about stress response. So you educate what's going on. You've got the rehearsal of coping skills. And then you've got trying to apply that into the real world. So the client would identify any triggers and develop ways of coping with this through relaxation, self-talk, or gradually facing the stressor to reduce the impact. Biofeedback, you've got physiological measures, so body functions like heart rate, blood pressure, and muscle tension. The good thing with this is if you're wired up to some biofeedback and you do, say, a breathing relaxation technique, you can witness your blood pressure and heart rate come down, so you can see the immediate effect of doing it, which is quite good. And it creates that sort of power of autonomy, like you've got control over it, you can do something about it. More awareness. So the main thing is to develop some long-term coping skills, but you do have to invest time into the therapies like whereas a drug therapy that might offer a quick release from the symptoms, but doesn't have an underlying cause. There are differences in terms of gender and social support. Social support is a big one to help with stress. Males and females respond differently to stress. Gender differences, so women typically have a greater physiological stress response to interpersonal conflicts and relationship problems, while men demonstrate higher reactivity to achievement-related and competitive stressors. So females generally respond to fight, flight with tend and befriend, which is more common for women. So this involves talking, getting social support, caring for others. Whereas men, and also the difference could be to do with hormones like oxytocin and the evolutionary pressures related to childcare and social bonding. So women tend to use emotion-focused coping like social support and expressing emotions, whereas men tend to employ problem-focused approaches. They're probably less likely to speak to people and seek help for stress. Although things are changing over the last few years, with more men talking about mental health. Social support as a stress buffer. So social support is crucial. It's a very powerful protective factor against stress. And so any strong social networks offer emotional support, practical assistance, and the quality of these social relationships is more than the quantity. So it's better to have people you can trust and have empathy with and mutual respect. They tend to offer the best buffering effects. If you've got conflicted or demanding relationships, that can probably increase stress, which is not good for your health. So social support influences health through multiple pathways. So it can encourage healthy behaviour, provide practical help during a crisis, and even enhance self-esteem, which helps the physiological stress response. So if you look at some of the statistics, so there's a 23% stress reduction where you've got good social support networks, 50% reduced risk of cardiovascular disease in people with high social support, and faster recovery from illness due to adequate social support. So understanding these individual differences in stress response and the protective role of social support is crucial for developing stress management techniques and skills. And these kind of insights highlight how important it is to consider gender, personality and the social context. And also I think exercise again can be a big buffer against a lot of daily hassles and stress, and also chronic stress. People typically report feeling better after doing some exercise. So I hope this video helps with stress unit, and thanks again.